Hello, everyone, and welcome to ADO's March webinar. With World Kidney Day coming up next week, we've put together this presentation on all the reasons to thank your kidneys. Here to help us explain more about kidney functionality is today's speaker, clinical assistant professor from Georgetown University and ADO's medical director, Dr. Howard Zahalsky. Welcome, Dr. Zahalsky, and thank you for joining us today.
Thank you, Tom. All right, so today we're going to talk about the kidneys. And to start with, I want to go over exactly where the kidneys are. The kidneys are actually towards your back. A lot of people think of them in your lower back, kind of where people tend to get back pain, but they're actually significantly higher. They're around where the lowest rib ends in the middle on your back. So the point of this is that the kidneys are nowhere near your bladder, and that's what this slide is intended to show. What you have is the kidneys, and you have this long tube called the ureter that I'm going to get back to later that drains into the bladder, and then the bladder holds your urine, which has now been made, until it is convenient and until there's enough of it that you actually have to go to the bathroom, and then you empty your bladder. This long tube that drains out of the kidneys means that there has to be a lot of urine draining down before it will back up all the way into your kidneys. And we will get back to that in a few minutes. The other element of the kidneys that's important to note is that the kidney function is very redundant. What does that mean? That means that you don't need much of your kidneys to work in order to have a fully effective kidney system. If 1/5 of one kidney is functional, then at least on the blood work and in terms of what they are supposed to do, your kidneys will be working perfectly. Now, because there are two kidneys and because there are two ureters, if you were to, for whatever reason, block one of the ureters, and because you only need 1/5 of one kidney to be working to do all of the job of both kidneys, your body really wouldn't care too much. So you can completely block, cut off one ureter, you can donate one kidney, and as long as the other side is still working, your body won't have any problem. So what are these jobs that the kidney has that we will appreciate so much? Water. The main job, the first job of the kidneys, is to eliminate excess water. Our bodies are basically a bag of salt water. In our body, we have obviously water, which makes up 60 to 70% of the human body, but that is combined with salt to give our bodies a naturally salty complexion, if you will. You need the proper balance of salt and water for our body to operate effectively. And if there is an alteration in the concentration of salt relative to water, that can cause a lot of problems, especially neurologic problems. Everything you drink, whether it be water, whether it be juice, whether it be soda, even those electrolyte solutions like Gatorade and Powerade, they all have much more water relative to salt. If we actually drank something that was the same amount of salt and water as our human body is naturally, it would taste disgusting, way too salty. Not quite as salty as seawater, but still way too salty for you to want to drink a significant amount of it. So every time you drink some water, your body has to keep enough water to balance out the salt that we've eaten, but then get rid of all of the excess water. The kidneys do a very good job of this, eliminating the extra water that you drink through a normal day of just drinking even just a couple of cups of water. But getting rid of the extra water is not the only job that the kidneys have. In fact, as far as you're concerned, there are several other jobs that, although they're not the primary job of the kidney, may be just as, if not more important. Here you see a nice colander that you might use to put in your sink and pour a pot of boiling water and pasta in it. You expect the water to go through all those little holes in the colander and all of the pasta to stay in the colander so that maybe you could serve that for dinner. Kidneys are like this. They are a giant colander or filter for your blood supply. Their job is to let the stuff that is not supposed to go, that is not supposed to be in your body, like the extra water, through, and that drains through the colander and therefore out into your urine. But it is very important, as they are getting rid of this extra water, that they actually filter and hold on to the good stuff, the pasta, if you will. What is the good stuff that the kidneys are supposed to hold on to? Proteins, mainly proteins. So, for instance, hormones are a type of protein. Your blood is filled with proteins that the kidneys are supposed to hold on to and not let out while getting rid of the extra fluid. What is the stuff besides for water that your body is in fact supposed to get rid of? Well, what is the liquid that your kidneys produce? It's called urine. Have you ever wondered where the word urine comes from? It comes from urea, which is a key ingredient in urine. Urea is a product of the breakdown of proteins. So you want to keep the good proteins, but over time, proteins get old and worn out and break down, and you want to be able to get rid of those garbage, broken down proteins, while at the same time keeping the healthy proteins. And the kidneys are very good at this. They strain out the urea, the broken down pieces of protein, while keeping the whole proteins. This is because the little holes in the colander are the right size to hold on to a whole protein, but those little pieces of broken down protein slip through. Again, that might be why if you pour your boiling pasta into a colander, if you have a couple of pieces of pasta that broke and they're just tiny little shards, you might find them in the bottom of the sink, even though all of the big pieces of pasta are still caught in the colander. So holding on to good proteins, getting rid of garbage proteins, another important function of the kidney. Yet there's more. Crystals. Your body naturally produces certain crystals. One of the main crystals that it produces, which you might recognize the sound of the word, is uric acid crystals. Uric acid crystals are also crystals produced from this urea, these broken down protein products. And if you don't get rid of enough urea and the uric acid crystals, then what do you develop? Well, many of you have probably heard of the term gout. Gout is when the urea builds up in your body and crystallizes and forms a painful crystal that hurts like the dickens, usually at the base of the big toe. So getting rid of the uric acid crystals is another important job of the kidneys. Your kidneys are essentially preventing you from developing gout. But even beyond the stuff that the kidney gets rid of, the water, the broken down protein particles, the uric acid crystals, your kidneys still have several other functions that are not related to getting rid of stuff. Most people know that your blood vessels are filled with little blood cells. Where do those blood cells come from? Well, no, they don't actually come from the kidneys. They come from the bone marrow. Inside every bone, there's a soft area which your body uses to actually make blood cells. But what determines whether that bone marrow makes more blood cells or less blood cells? Who's watching over the blood to make sure there's the right amount of blood? As it turns out, it's actually the kidneys. There is a chemical produced by the kidneys called erythropoietin. If your body senses that you are a little anemic, that you don't have enough blood cells, it's the kidney's job to sense this and call on the bone marrow to produce more red blood cells. If the body senses that you have plenty of blood cells, then your kidneys will decrease the level of erythropoietin and turn down the number of new blood cells being created. Yet there's still some other jobs that the kidney has besides elimination of garbage, elimination of water, and making blood cells. These kidneys do a lot of work on a lot of different parts of your body. It's actually your kidney's job to control blood pressure. You may think that your heart must be really involved in blood pressure. After all, it's what's pumping the blood around the body. The heart is a passive organ. Your heart pumps regularly once every half a second to a second and pumps with the same amount of force, usually each and every pump. What determines blood pressure more than the heart's pumping power is how tight the blood vessels are. the kidneys produce chemicals that can either tighten or loosen the blood vessels and make your blood pressure go up or down. Why would the kidneys do this? Well, again, it's the kidney's job to get rid of a lot of the garbage, the urea, that's in your body. So there has to be enough flow to the kidneys. If the kidneys sense that too much crud, urea, crystals are building up in your bloodstream, they will increase your blood pressure to increase the flow of blood to the kidneys so that they can filter more blood and get rid of the urea faster. If, on the other hand, the kidneys sense that there is less crud floating around in your bloodstream, they will lower the blood pressure because they don't need to be doing as fast a job of filtering. There are some ways that this process can go wrong. There are some conditions, including a genetic condition that young women often have, where you build up blockages in the arteries that lead to the kidneys. Because of this, the rest of your body is getting plenty of blood, but the kidneys themselves are getting less blood, and they detect a low flow state to the kidneys. They feel like they're not getting enough blood coming to them, and they're not able to filter enough blood. So what do? They say that means the blood pressure must be too low, and your kidneys will cause your blood pressure to go up and up and up to try and push blood past the blockages so that they can filter enough blood to get rid of all of the waste products. On the other hand, the rest of your body doesn't need any more blood, and as a result, your whole body blood pressure will go up just because the kidneys sense that there's less flow to them. So that's quite a number of things for the kidney to have to worry about in a typical day. They got to eliminate the fluid, they got to eliminate the protein waste products, they have to get rid of crystals, they have to control the blood count, and they have to watch over the blood pressure. Because there are so many things the kidney's doing, there's a lot of things that can go wrong. Here you have an innocent balloon, but this could very easily be a kidney. Remember back at the beginning I said pay attention to those ureters. If you get a blockage in one of the ureters, that kidney will start to swell up like a balloon. We call this condition hydronephrosis. You may be completely unaware that one of your kidneys has hydronephrosis because the other kidney may continue to work very well. You don't realize that a little bit of scar tissue or possibly a kidney stone, which is the main reason people get hydronephrosis, has blocked one of your ureters, maybe right at the area where you see that balloon tied off. The kidney can get bigger and bigger and bigger and can even subsequently get infected, and until you actually get the infection, you don't know that that kidney has been slowly being blown up like a balloon. Fortunately, this is a treatable condition, and kidneys are very resilient, and even after the kidney's gotten blown up, if you go in and a urologist is the type of doctor that usually does this, you can go in and get rid of that kidney stone, either blast it with sound waves, a procedure called lithotripsy, or even go up through the bladder into the ureter with a tiny little scope and pull out the kidney stone. That will allow the kidney to drain, and then the kidney can recover. What else can injure the kidneys? Well, remember, the kidneys do usually control blood pressure, but sometimes blood pressure can be a double-edged sword as far as the kidney is concerned. As we get older, our blood vessels tighten, so even if the kidneys say, hey, loosen down a little bit, lower the blood pressure, sometimes your blood vessels aren't able to respond to the kidney the way they did when you were 14 or even 24 years old. What happens then is that you have this high blood pressure that the kidneys don't want pounding at the kidneys like a jackhammer. Imagine you took this jackhammer to that colander we saw earlier on in the presentation. You're going to blast extra holes in that colander, and the kidneys are going to have a hard time doing their job. It's not so much that they're not going to be able to get rid of the waste products or the fluid, but they're going to lose some of the pasta down the drain as well. You're not able to hold on to your healthy proteins, and this can cause problems in terms of how your body functions. One of the most common things to hurt the kidneys, however, is medications and drugs. There are a lot of medicines that don't always agree with your kidneys. The top offenders are what's called non-steroidal anti-inflammatory drugs, or NSAIDs. You may know them by their more common names of ibuprofen, Motrin, Aleve, Naproxen. Those are medicines that change the dynamics of the flow in the kidneys. And that would be a whole lecture in and of itself. But suffice it to say that those medications, not usually if taken one pill or two pills here and there, but if taken in significant doses on a regular basis, maybe because you have bad arthritis and are taking ibuprofen on a regular basis, can really do some damage to the kidneys, especially if you have high blood pressure already and it's already beating on the kidneys. Taking those medications can be very harmful for your kidneys. The final thing that I want to talk about in terms of its damage to the kidneys is diabetes. Many people with diabetes end up suffering from kidney disease if their sugars are not well controlled. How does that happen? Well, when you have diabetes, there's a lot of sugar flowing through your blood. This actually thickens the blood. I want you to think of it as if the blood becomes kind of honey. Imagine now, instead of trying to pour water through that colander, trying to pour honey through the colander. It's thicker. Some of it will, in fact, drain through the colander. But what you're going to end up with is a nice glaze of honey on top of the colander. If you let that dry, many of those holes in the colander end up getting clogged up. That's an approximate way of how diabetes will hurt your kidneys as well. The sugar that's floating through your blood will clog up the filters in the kidney and prevent them from doing their job. Now they won't let anything out. It makes it harder to get rid of the extra water that you drink, as well as harder to get rid of the waste products that the kidney is supposed to remove. When those waste products build up, that can be very harmful for the whole body, and among other things, it can lead to high levels of confusion. That's the kind of problem that can ultimately lead to dialysis. With dialysis is where we take over the job of your kidneys for you, and you have to be hooked to a machine several times a week for several hours at a time so that the machine can pull out the crud and protein waste from your body since your kidneys are no longer able to do it. So what have we learned today? That your kidneys actually have many, many jobs, but that they're also very sensitive to drugs, to blood pressure changes, to diabetes. But if you take good care of your kidneys, if you watch your blood pressure, if you watch for diabetes, if you make sure you drink enough water so that the kidneys can do their job, you will end up with a pair of very happy kidneys that usually are strong enough to last you for your entire life. So now that we've learned a little bit about kidneys, I want to talk about how Activ Doctors can help you manage your kidneys. Activ Doctors has three important components that we're very proud of. The first is our personal health records. With our personal health records, you're able to monitor and we're able to acquire for you all of your medical records from many different doctors and put them all in one place. This will, specifically as it relates to the kidneys, allow you to track your kidney function. Kidney function is usually measured with a simple blood test called the creatinine. There can be very subtle changes in your creatinine which can actually make a big difference. And the most important thing when looking at your creatinine is to look at the trend. With your personal health records, you can keep all of your creatinines from all your different doctors, and you can see not only an individual number, but a trend to let you know if there's some reason to be concerned without your kidneys. What if your kidneys don't look like they're healthy? What if you're having trouble with your kidneys? Our second medical opinions can put you in touch with one of Activ Doctors' experts from around the country and around the world, and we have some of the top doctors from around the world and some of the best trained doctors here in the United States. When you purchase one of our second medical opinions, our doctors will review your online chart and give you their best advice on what the next step might be in terms of improving the function of your kidneys. Finally, with our e-consultation feature, if your doctor is a member of Activ Doctors Online, you can use our platform to have an online discussion. Maybe you had a kidney test done, and you just want to talk to your doctor about what your options might be or what you need to worry about, rather than having to go all the way back to the doctor's office just to review a test result. An e-consultation with your doctor might be a great solution for you. With that, I'm going to turn it back over to Tom, who can tell you a little bit more about Activ Doctors' plan and vision.
Well, thank you, Dr. Zahalsky, for another interesting presentation. Here at Activ Doctors, our vision is to reinvent healthcare by providing user-friendly mobile health solutions that allow people all over the world to live safer, healthier, and more productive lives. We strive to educate, engage, and empower our members to take control of their health destiny to save time, money, and even lives. We hope you've enjoyed today's presentation, and we invite you to start a free 30-day trial over at activdoctorsonline.com and by clicking Get Started. For more information, to schedule a demo, or if you have any questions about our service, please feel free to contact Activ Doctors Online using the information on screen. Thank you very much for watching, and we look forward to seeing you next month for another informative health webinar.